Hi, I'm Jared.
And I'm Stephen, and welcome to the preoperative education session at St Vincent's Private Hospital, Toowoomba.
The purpose of this video is to highlight key information that will help you in preparing for your surgery, what to expect during your stay, and what assistance you may need in your recovery.
The information contained throughout this presentation is general advice and education only. Discuss any concerns with your treating team and please follow the directions of your own health professionals. This is our orthopaedic ward, St Anne's. It is located on level 2 of the main hospital building. It has a central nurses station, a close observation unit, and a number of single and double rooms with ensuite bathrooms. Across the hallway is our inpatient rehab ward, St Michael's. It also has a central nurses station, single patient rooms, patient tea room, and a gym space. From surgery, you will be moved from recovery before being transferred to the ward. Private rooms are not guaranteed, but will be allocated based on the ward's clinical needs. Your surgeon may also request that you are nursed initially in the close observation bay or in the intensive care unit, so that the nursing staff can monitor you more closely. A total joint replacement is usually done on the background of arthritis or injury, with the goal of decreasing your pain and improving your function and quality of life. During the surgery, the bone is prepared and a prosthesis is fit to improve joint movement and function. In preparation for your up-and-coming surgery, there are a few things you need to be aware of. Smoking needs to be ceased 4 weeks prior, as it affects wound healing and increases your risk of serious medical complications. Complete any dental work prior to your surgery due to the increased risk of infection. Certain medications such as blood thinners, fluid and blood pressure tablets, or diabetic medications may be ceased, adjusted before or after your surgery. This can be discussed with your treating team. Ensure you maintain a healthy diet in the lead up to your surgery. In hospital, you'll have access to a room service menu, which can be ordered from the phone in your room anytime from 6:30 in the morning to 6:30 in the evening. Bring in comfortable, loose-fitting clothing to allow for swelling and easy access for staff to check your wound. Bring your toiletries and regular medications, which must be in their original packaging. In hospital, you'll be fitted with non-slip socks. If you'd like to bring in your own shoes, make sure they have a good sole and will allow for swelling if needed. You will need to fast prior to your surgery, and the admissions team will contact you to let you know what time to commence fasting. There are some risks involved with any surgical procedure. Antibiotics are given to help reduce risk of infection. Medications, equipment, and exercise help to lower your risk of developing blood clots. Some blood loss is normal, but occasionally there may be a need for a blood transfusion due to postoperative anemia. This is some of the equipment you may see after your operation. Firstly, the AVIs, which provide compression through your feet to help prevent blood clots. This is a bronze or elevation block to help straighten your knee and manage swelling. This is a heel wedge to relieve pressure off your heels while resting in bed. This is an abduction block placed between your legs after a hip replacement to stop you from crossing your legs. There are a few different methods to manage your pain which will be determined by your treating team. This is a PCA, which is a button that you're able to press to administer a set dosage of pain relief through your cannula. It is normally taken down the day after your surgery. This is a pain buster that releases a continuous flow of anaesthetic through a small flexible tube inserted near your surgical site. It is usually removed on the second day after your surgery. You will also be charted for pain medications throughout your stay, and your nurse is the best person to speak with if you feel your pain is not well controlled. This is an ice machine. Nursing and physio staff can assist with applying cold therapy regularly throughout your stay to help with your pain and swelling. Cold therapy should be used at home after discharge. You can use any gel or ice pack as long as there is a barrier between it and your skin, such as a tea towel or a pillowcase. Anaesthetic, medications, and lack of mobility can cause issues with the regularity of your bladder and bowel function. As required, the nursing staff will administer medication to assist with moving your bowels. If you are having trouble with emptying your bladder after surgery, the nursing staff may need to pass a catheter. This will only be for a short period of time. You will discharge home with a waterproof dressing. Monitor your dressing for any signs of wound ooze. Small spots on the dressing and some itchiness are expected, but consult your surgeon if there is excessive wound ooze or the dressing has lifted.
Preoperative exercises can help you in being better prepared for your surgery and recovery. There are a series of exercises that you may like to attempt in the lead up to your surgery that are located in the Orthopaedic Patient Resources section on the St. Vincent's Toowoomba website. Be mindful that if any of the exercises feel aggravating, to not continue with them, and consider following up with a community physiotherapist for a preoperative assessment or some advice on some more tolerable exercises. After surgery, you will not be able to drive for a period of time, usually 6 weeks, and you may have some difficulty with some of your usual household tasks and may require some assistance with shopping, household cleaning, making the bed, or doing laundry. Plan for family, friends, or services to assist you with this on discharge. You may find it helpful to cook and prepare some meals to freeze and reheat later, or to organise for grocery delivery. To reduce your risk of a fall on discharge, we recommend removing trip hazards such as rugs and extension cords, using a nightlight in dimly lit areas and making sure furniture is at a comfortable height. Place commonly used items at waist height to avoid excessive bending and reaching, and consider a long-handled reacher to assist with getting dressed and picking items up from the floor. It is important that you always use the mobility aid as prescribed by your physiotherapist. A physiotherapist will come and see you after your operation to assist with planning for discharge and to get you up and moving. We will discuss your home setup, supports, equipment and aids, and your follow-up physiotherapy plans. An occupational therapist may see you to discuss more complex equipment requirements for challenging home environments. Throughout your stay, your physio will see you each day to progress your mobility, complete your exercises, and make sure you are prepared for discharge when appropriate. This is normally on day 3 post-operatively. On the wall in your room, you will have a journey board, which is a checklist to tick off as you progress, to demonstrate your readiness for discharge. Depending on the surgical technique used for your hip replacement, your surgeon may recommend that you restrict certain movements after your operation to reduce your risk of dislocation. These include bending your hip past 90 degrees, be cautious with putting on shoes and socks, dressing, sitting in low chairs and getting in and out of the car. Crossing your legs, whether sitting, laying down or on your feet. And twisting, such as laying on your side or when turning on your feet. Often these positions can be breached through trips and falls. Getting in and out of the car can be difficult after your total joint replacement. To make this process easier, we recommend moving the passenger seat back and reclining the backrest so you have more room to get your legs into the car. It is important to complete your post-operative exercises as prescribed by your physiotherapist to aid in your recovery and rehabilitation after your surgery. Your physiotherapist will review these exercises with you during your stay. You can also find these post-operative exercises on the St. Vincent's Toowoomba website in the Orthopaedic Patient Resources section. Have a look at your chairs at home and make sure you have an appropriate chair that has armrests, is at a comfortable height with your hips higher than your knees. Height adjustable chairs are available from local equipment suppliers.
Post-operatively, due to your limited mobility, anaesthetic and some medications, there is an increased risk of blood clots and chest infections. To reduce your risk of these adverse events after surgery, it is important that you sit out of bed frequently throughout the day, such as sitting out for all meals, and that you complete the recommended breathing exercises every hour. To perform your breathing exercises appropriately, take a slow deep breath in, hold at the top for 1 to 2 seconds before exhaling. You will be required to repeat this exercise 10 times every hour. If this exercise makes you feel lightheaded or uncomfortable, discuss with your physio or your nursing staff. The nursing staff may also supply you with a tri-flow breathing device to assist and remind you to do your breathing exercises.
Your nursing staff will assist you initially with showering and dressing as required during your stay. It is important that you can do this independently with the necessary equipment and services in place for discharge. You will require an over-toilet frame and shower chair, which needs to be organised prior to your surgery by hiring or purchasing from your local equipment suppliers or pharmacy. If you have any concerns about your home environment, let your nurse or physiotherapist know, as we may request one of our occupational therapists see you for advice on specific equipment. After your surgery, your physiotherapist will assist you to walk using an appropriate mobility aid. You will initially require a walking aid that will provide more support. During your recovery, your physiotherapist will help progress you to a walking aid that is appropriate for you on discharge. For most people, we are aiming for crutches, but this depends on your individual circumstances. In most cases, it is important that you can safely navigate stairs prior to discharging, whether you have stairs at home or will encounter them in the community. Your physiotherapist will help you to manage stairs safely depending on your circumstances. We recommend that you continue to have physiotherapy input after your acute period of recovery post-surgery. There are several options for ongoing follow-up physiotherapy. Private physiotherapy follow-up in the community using your private health extras cover if eligible. Rehab in the home, a service funded by your health fund where a physiotherapist will come to review you at home face-to-face or via telehealth after discharging from hospital. The frequency of physiotherapy visits and the duration of follow-up is dependent on which health fund you are a member of. This service is also dependent on the demand for services and your location, and as such is not guaranteed. Or inpatient rehabilitation, which may be appropriate for you depending on how you progress post-operatively. This will be a decision made between you and your family, your doctor, your nursing staff, and your physiotherapist. It is important that after your knee replacement, you begin to work on your knee range of motion, which is getting your knee bending and straightening again. This can be difficult due to pain and swelling, but is very important for regaining a good walking pattern, improving your long-term pain, and allowing you to do other functional tasks, such as getting up from chairs and getting in and out of the car. Your physiotherapist will help you through this part of your recovery, and your knee range of motion will be written on your journey board each day. Remember that when you are resting in the hospital bed, make sure you have your knee out straight with nothing underneath it and no bend in the bed. If you have ticked off everything on the checklist and have appropriate supports and equipment in place, you will be cleared for discharge home from a physiotherapy point of view. Your official day of discharge will be determined by your surgeon.
We hope you are feeling better prepared for your up-and-coming surgery. If you have any further questions, please don't hesitate in contacting St Anne's Ward on 4690 4139. We look forward to seeing you soon.